We're in Amsterdam today with Doctors Leonie, Schelke and Jansen. They are pioneers in the use of ultrasound in the field of cosmetic medicine. Let's have a chat to them. Hi Leonie and Oscar. You guys are widely recognized and respected in the field of cosmetic medicine. Where do you see the use of ultrasound in this field?
We are using ultrasound for 10 years now for complications of filler treatments. And we're seeing 500 new patients per year. We have a long waiting list. We see 2 to 6 vascular adverse events every month. And we know that patients vary and they have a lot of variations in the course of their vessels. And it's not being not a good injector, and we know our anatomy, but once in a time, and it may be after 1 year, it may be after 24 years, you may run in somebody who has a variation of the vessel course and have a complication you don't want to have. So we're treating them, and then I thought, why not preventing them? So if you do your ultrasound examination before treatment, you see permanent fillers that people forget that they had. You see variation, and you can have a safe injection plane, and you know where to inject.
Oscar, from a radiologist's perspective, do you find it hard to train non-radiologist doctors in the use of ultrasound?
What we see is that a 2-day course is enough to get you started. Like I always say, when you completed the course, you've got your driver's license, and then you've got to learn to drive. So you gotta go out in the traffic and you make your miles. So after completing the course, when you start doing ultrasound in a daily fashion on your patients and maybe even on your neighbors or your family members, just to get to an insight in the anatomy and in the variations there are, I think a 2-day course will actually learn you to do facial ultrasound. Yes.
There are many experienced injectors who feel that it costs them time, money and training in order to incorporate ultrasound into their practice. They think that they've been doing it for years without any problems. What are your thoughts on that?
It is investment in time and money for patient safety. And it's as in other medicine. If you look at anesthesiologists, if you look at orthopedic surgeon, they're not doing injections without ultrasound because you are more accurate. And you're doing it for that small population of patients that is different, which is always has been the case in medicine. You're always doing small things to protect a certain group.
Yeah. What we see is, I do training not just for facial anatomy, but I do trainings for surgeons, anesthesiologists, pediatricians, you name it. What they say at first is, this is going to cost me a lot of time. When I do my physical examination, I'm way faster, which is true at first. But as you gain experience, we can reduce the time for your initial examination for facial anatomy, especially for the area you want to treat, for let's say about 2 or 3 minutes, and you have a real-time anatomy. You have a real-time insight in patient's anatomy and in their variations, which is obviously very important.
Thank you both for sharing your wisdom and experience. The course has been immensely enjoyable and we've really learned a lot from it. So thank you very much.